Care Alliance. And we welcome the fact that the Global Strategy for Women's, Children's and Adolescents' Health takes a life course approach that aims for the highest attainable standards of health and well-being at every age. And this is essential as we care for our children and adolescents, and as we ensure that everything possible is done to end preventable deaths and improve health and well-being. And key to that is the management of communicable and non-communicable diseases. And we've already heard in the presentation about the impact of the pandemic on the care provided for children and adolescents. But alongside this, sadly, not all deaths in children and adolescents can be preventable. So we also need to ensure that they and their families have access to palliative care services when needed. And the strategy itself talks about the fact that in 2014, there were 5.9 million deaths in children under 5, 1.3 million adolescent deaths. And we also know that more than 5.3 million children under 15 experience serious health-related suffering each year, and 98% of those children are in low and middle-income countries. And having just heard the really interesting presentation around the work that has been going on with regards to the strategy, there are certainly many areas, including the issue of perinatal and neonatal care, where palliative care can be integrated. So as palliative care is a core component of universal health coverage, how does WHO aim to work with member states and civil society to integrate palliative care throughout all maternal and child health programs, and to integrate palliative care within the global strategy in order to reduce unnecessary pain and suffering?
Would you like to have your questions answered or any comments made to your intervention, Julia, or can we move on to Florence and have yours and Florence's answered together? Florence, would you be acceptable to that? And Julia?
Yeah, that's fine.
Okay, please go ahead, Florence.